One photo. A single moment that captured the impossible. A doctor who refused to give up. And a patient who might have just changed history forever. You probably already saw the photo, but what really happened in this room? And what did performing the operation cost him? Tune in to find out. It's 1985 in Poland. Healthcare system operates under a universal model, but it faces significant challenges due to underfunding, outdated equipment, and limited access to specialized care. Public health care was funded through government contributions, and nearly all residents were eligible for free or low-cost services. However, the system struggled with long waiting times for treatments and surgeries, a shortage of medical specialists, and inconsistent service quality between urban and rural areas. Globally, investments in medical devices remained modest for much of the 20th century, with slow growth even through the 1980s. Poland's healthcare budget at the time paled in comparison to many Western countries, making Dr. Religa's groundbreaking heart transplant even more extraordinary. Fast forward to today, and we see a dramatic increase in global spending on medical technology, surpassing $600 billion annually. Yet, even now, the disparity in healthcare funding between nations remains stark, and budgets in many regions still struggle to meet growing demands. The room was quiet, the kind of stillness that made every passing moment feel heavier. Tadeusz Żytkiewicz, 61 years old, had been waiting for what seemed like forever. His doctors had given up on him, declaring his condition untreatable due to his age and the risks. But then, it was the hospital. A heart had been found. The donor, a person in a coma, later declared brain dead, had given Tadeusz a lifeline. The organ was en route from Warsaw to Zabrze, where Dr. Zbigniew Religa and his team were preparing for a high-stakes 23-hour operation. The patient in Religa's historic heart transplant surgery was suffering from severe heart failure caused by a condition known as coronary artery disease. This condition involves the blockage of the coronary arteries, which are crucial for supplying blood to the heart muscle, leading to a decrease in heart function. Over time, the heart becomes weaker, and a transplant becomes a necessary option when all other treatments fail. In Żytkiewicz's case, his heart had deteriorated to the point where a transplant was his only chance for survival. In the 1980s, heart transplant surgeries were still in their early stages, and the survival rates reflected the many challenges involved. In 1980, the one-year survival rate for heart transplant recipients was around 75%. However, these early transplants were fraught with difficulties such as organ rejection, infection, and the limited availability of donor hearts. Luckily, that wasn't the case for Tadeusz. Every heartbeat was a gamble. Every second, a reminder that failure was not an option. The transplant was a collaborative effort involving many individuals, but Dr. Religa's team was especially notable for not strictly adhering to the formal roles seen in Western surgeries. Some of his team members were medical students or even volunteers who had never been involved in such a complex procedure before. Their determination to succeed, despite lacking the full experience, and advanced resources added another layer to the story. The iconic photo of Dr. Zbigniew Religa in the operating room, which shows him looking intently at a heart monitor while his assistant is slumped in the background, was taken by James L. Stanfield, a photographer working for National Geographic.
Worked for a newspaper no more than 5 years. Learn all you possibly can, especially color, and go on to a magazine if you're worth your salt. And so I stayed at the Milwaukee Journal 5 years and 11 days, and I had the chance to move on to National Geographic, and I did. And I've been there ever since.
The photo captured not just a medical milestone, but also the emotional and physical toll of the procedure, with the exhausted surgeon and his team persevering through a 23-hour surgery. The image was part of a larger feature on Poland's healthcare challenges in the 1980s, a time when the country was undergoing significant political and social changes, making the heart transplant story even more profound. Stanfield's intention behind taking the photo was to document the breakthrough in heart surgery and the remarkable efforts of Dr. Religa and his team in a context where resources were scarce. The photo highlights the high stakes of the procedure and the human drama that unfolded during the transplant. It became an iconic representation of not only the medical achievement, but also the emotional gravity of pioneering life-saving efforts in a difficult political climate. Religa's contributions set the stage for many of the advancements we see today.
Następujące. W moim głębokim przekonaniu przez najbliższe kilkadziesiąt lat nikt nie wymyśli lepszego serca niż jest serce ludzkie.
But we can replace it. Slightly worse devices. Like what? For example, an artificial heart, which we just mentioned a moment ago. The second possibility, which will certainly be realized soon. These are heart transplants from animals, specifically from a pig. But that is not our main objective. The main objective, I don't know when it will be achieved. In 20 years, but maybe even in 80 years. No, however, one's own heart grown from one's own cells, that is from my own cell, a new organ at the moment when the old one fails. That is the idea, the goal, the dream we will strive for.
From artificial hearts to 3D printed organs, modern medicine builds on the foundation laid by pioneers like him. In 2023, surgeons in the United States successfully transplanted a pig's heart into a human, a groundbreaking step in addressing the global organ shortage.
It really is remarkable. So surgeons here at the University of Maryland Medical Center were able to put a pig's heart successfully in a 57-year-old man's body who was suffering from a deadly heart disease. This is something doctors here tell me that they've been working for decades, and now it has finally become a reality.
Even though that wasn't the first allotransplant attempt, the potential is quite clear. Back in 1967, Dr. Christian Barnard performed the world's first human heart transplant in Cape Town. His patient survived for just 18 days. A few months later, his second patient astonished the world by living for an incredible 19 months, a feat that proved what once seemed impossible could become reality. Such feats would have been unthinkable without the groundwork laid by Religa and his peers. Dr. Religa's surgery was more than a medical achievement. It was a statement, a reminder that progress often comes from those willing to push boundaries, even when success seems out of reach. It just so happens that Tadeusz Żytkiewicz, the patient in this iconic photo, outlived Dr. Religa thanks to the groundbreaking operation he performed that day. Dr. Religa passed away on March 8th in 2009, but his contributions to medicine and his unwavering determination continue to push the boundaries of science that have left a legacy that continues to inspire the world. Performing that historic operation came at a significant cost to Dr. Religa. Physically, the toll was immense, working 23 sleepless hours in a single surgery, often repeating such grueling schedules for his patients. This photo reminds us that breakthroughs aren't clean or easy. They're messy, exhausting, and sometimes heartbreaking. But they're also why people like Dr. Religa become legends, because they show us what it means to truly care, to fight for life, no matter the odds. Here at InFrame Media, we plan to introduce you to over 100 iconic photos. To reveal the next photo, make sure to support the video. Follow our YouTube channel page to discover the next episode's photo and fund the production. Thank you for watching.